It's not unusual after a patient has been diagnosed with fibromyalgia for them to ask an awful lot of questions. And it's also not unusual for many physicians to tell these patients that their symptoms are all in their head. Well, let's talk about that for a moment. Why do doctors think that the pain is all in your head? Doctors cannot see and may not understand the sources of your pain or your fatigue. However, what they do observe is your anxiety and your frustration with having to deal with these symptoms around the clock, which may wrongfully lead them to conclude that your symptoms are of a psychological nature. Also, the old school of thought regarding pain is that it is produced by tissue injury, and there is no obvious source of tissue injury in patients with fibromyalgia. So regardless, if your doctor does not believe that your symptoms are real, you owe it to yourself to find another doctor who believes in you and will work with you to help reduce and manage your symptoms. Now, fibromyalgia can be difficult to diagnose, granted, even more difficult to manage, and it affects every patient differently. If you're newly diagnosed or you think you might have fibromyalgia, choosing the right healthcare provider is one of the most important decisions you can make. Not all doctors have the same or the right training and education needed to properly manage this condition. You'll want to find someone who has experience in the field and is sensitive to your symptoms. Try to steer clear of providers who believe fibromyalgia is all in your head. It's important to feel like you're on the same team, so choose your doctor carefully. So what about finding Dr. Right? If you suspect you have fibromyalgia, start by visiting your family doctor. He or she can provide an initial assessment and recommend a specialist if needed. Now, if you've recently been diagnosed, don't be afraid to ask your regular healthcare provider if you should see a specialist. You may also want to find out whether there is a pain or rheumatology clinic nearby. Now, those who have watched a close friend or family member with one of these syndromes can find themselves wondering, wait a minute, is this real? Is she making this up? Patients oftentimes fear the worst. Patients themselves say to themselves, will I ever get my life back? Will no one ever believe me? Is this all in my head? The big challenge here is credibility. This illness is still not well understood. That's the bottom line, and that's the source of all of the conflicting information that you see everywhere that you turn for help. So when people don't see anything unusual about you, they question whether or not you're sick. However, the war between the doubters and the advocates has waned. The consensus is that this illness is truly a mind-body disorder, in which biological and psychological causes and dysfunctions are inseparably intertwined. The mind seems to play a key role in kickstarting and perpetuating illness, but it's not that sufferers are simply malingerers. Their bodies are sick, and their reaction to the illness often makes it worse. Anybody who has a chronic illness has alterations in biological and psychological mechanisms. You really cannot separate the brain from the rest of the body because psychology is biology. Everything that takes place in the brain is chemical or electrical. You can't have one without the other. But you can have an evaluation that takes all of these things into consideration to help in isolating the cause, the triggers, and the solutions. Doctors are now beginning to suspect that by continuing to focus on an elusive biological cause, they could be missing out on the other half of the picture and the chance to find a solution. They have begun to re-examine the role of severe stress, depression, and even personality traits in initiating and fostering this disorder. Now, unlike other diseases, fibromyalgia is closely connected to psychological distress, genetics, environment, and coping mechanisms. In my practice, I found that the closer we can get to the origin, the easier it is to understand the mechanism. And in understanding the mechanism, the symptoms can be turned into solutions. So I invite you to join me on this journey for solutions for fibromyalgia. You know, over the years I've treated hundreds of fibromyalgia patients, and they've all asked me very similar questions about living with fibromyalgia. So if you've found this information valuable and you'd like to get the rest of the 20 frequently asked questions, then go to www.answerstofibromyalgia.com. In addition to these videos, I'm going to send you my fibromyalgia roadmap, a visual guide to controlling the symptoms and minimizing the discomfort of this disease, including what you should be doing over the next 90 days. This is Dr. Richard DiCenso, and here's to your health.